Hey guys, welcome back to my channel. It is Catalina of Catalina's Classroom, and this is where I talk to you guys about the holistic herbalism perspective when it comes to gut health, skin health, hormonal health, as well as general overall wellness, as well as this is where I like to talk to you guys if you are in the skin industry and you want to kind of break from the mainstream narrative of things and begin exploring and deepening your knowledge and education on the holistic approach to acne and skin as well. I welcome you here. And if you are somebody who is on your holistic acne healing journey and you don't know where to start, you are also in the right place. I have a few other videos too about my own journey that you can go and check out. I'll link it down below too. Before we get started, a few things. If you're not already subscribed to the channel, please go ahead and do that. I want to get to 100 subscribers before the end of November. This has been really exciting to start the YouTube channel, so it would mean a lot to me if you guys would just hit that button, give the video a like, and let's get into it. So, full disclosure, I have seen this video before. It got sent to me by Jasmine, who follows me on Instagram, and I really appreciated it because I was like, oh, this is super cool. I would love to give my own insights on it from my side of the fence when it comes to acne and acne healing. So thank you to Jasmine. And another thing is that I wanted to make a note. One of the studies that I cite here today, the first line it started with was, despite the growing popularity of isotretinoin therapy, we do not know the full side effects of this drug. Plain and simple like that. And I just want to kind of make this disclaimer of, listen, the pharmaceutical industry, the main medical industry or system, Western medicine, as much as we like to look at these institutions as all-knowing beings, they don't know. They are constantly evolving, as well as the safety and efficacy of these drugs is always evolving with it too. That's why you will see drugs and products that were labeled as safe for children to use, for women to use, 20 years from their start date or their date into production, there are countless lawsuits because it turns out that it's actually not a good fit for women. It's not a good fit for children. It's actually poisonous. There's so many different things that come to light over years of research when it comes to these drugs. So nothing is set in stone here. And if you're somebody who is a huge advocate for the mainstream medical system as well as these institutions, there's nothing wrong with that. I just simply ask you, keep an open mind, because nothing is as solid as it seems from the outside looking in, and that's why a lot of people get into the field that I'm in, the alternative medicine field, because we start seeing, oh, your doctor doesn't actually know best. There are good doctors out there. There are good drugs out there that serve a great purpose for health, but is it all of them? No. And I think that people should be able to critique them and to voice their opinions and be able to say, listen, I don't know all too much about this. Is this really safe? And that's what I'm doing here in this video, because I think Accutane is a worthy drug to be critiquing, because you guys will hear about it. We'll watch the video together, okay?
Longer as well, because they really have to dry those oil glands up.
Something to note about being on Accutane is that you need to get a blood test every month. If you are a person with a uterus, it's really important.
If you are a woman, you need to be on a bunch of birth control for Accutane. You are not. If you look up the medical insert for Accutane, the very first thing that it has on the insert is a warning, a black warning of, do not get pregnant while on this drug, because your child could have severe birth defects. But yeah, not a person with a uterus if you're a woman. Women are the only people that have uteruses.
Important that you don't get pregnant while on it, so you also need to get a pregnancy test every month and be on 2 forms of birth control.
It's time to take the first.
Not just 1 form of birth control, 2. That is how imperative it is that you don't get pregnant on this drug. That is how that's how much of a risk there is. They have you on 2 forms of birth control. And this is my whole issue. One of the issues that I have with this drug, where it's like, how worth it is it if you have to jump through all these hoops? And this isn't even this is just the tip of the iceberg, having to take the birth control and get a pregnancy test. You also can't donate blood while you are on this drug. Let me say that again. You can't donate blood. Your blood could, if you're on Accutane, your blood could literally be toxic to somebody else's. And this is the point. Is it worth it? If your body is literally turning into something that is almost uninhabitable, to just have clear skin. I've been on the side where you take doxycycline and you take all these drugs. I was never on Accutane. I took doxycycline. I know what it's like to feel desperate. I know the toll that acne has on your mental health. But is it really helpful for us to be just throwing drugs at people? Why not instead broaden the perspective of why is this acne happening? Maybe it's not as simple as just the sebum is overproducing oil. There's something more going on there. And seeing this is just like... Let's continue.
I got eczema for the first time. I had dry, itchy patches all over my body. I had to be prescribed a cream for it. I got terrible sores.
So she says she gets eczema while she's on Accutane, and the question I asked was why. And this is my hypothesis. I believe that it happens because Accutane has to be filtered by the liver. It's a very strong drug, though, so it could put a strain on the liver. And when this happens, liver stagnation or liver detoxification can be put at a disadvantage. Now, a study that I did look up and did read into said that less than 1% of people who discontinue Accutane experience elevated liver abnormalities, which means that it's not common or it's considered rare. But I want to remind you guys that this is through the lens of an allopathic medicine view, where liver issues range from hepatitis to fatty liver disease, and that's really it. So if we were going to look at this from a holistic herbalism point of view, an issue like eczema is linked back to the liver. Skin issues in holistic herbalism are typically liver-induced. It means that the liver is not detoxifying the way it should be, or it has excess hormones like estrogen that are not being filtered out and then pumped into the waste via the bile. This is what happens. And then situations like acne and chronic eczema happen. Let's keep going.
On the sides of my lips that hurt when I ate or opened my mouth at all. I always had to have chapstick on me, and it had to be Aquaphor or Vaseline or it didn't work. I had multiple nosebleeds a month because my nose was so dry. I would groan getting up from a chair or a...
I've seen this video before, but it's hard to watch every time because I can't imagine. Actually, I can't imagine. I was almost there, where it's like something hurts you so much, hurts the way that you live your life so much that you're willing to go through all of this just to attain clear skin. But I know exactly what it feels like. I used to cancel plans. I wouldn't date because of my skin. I wouldn't make friends. I would stay in terrible friendships because I had really low self-esteem. So I was just like, I might as well just take what I'm giving because I can't get any better. So I understand, I empathize, I sympathize with where she's coming from and why for her it's worth it. But oh my goodness, like, you might feel good on the outside, but if my body feels like a prison at the end of the day, I don't think I'd be able to do it because that's how I was. I took birth control for a very short amount of time. And I had to stop because I was just like, I hate feeling dependent on these. I hate taking this. I hate the act of having to take a drug and not really knowing what it's doing to, or knowing what the side effects are. And that's how I felt with doxycycline too. That's how I felt with my antidepressants. And I get that different strokes for different folks. I'm just being honest in saying that pill popping was not for me. Like, it didn't feel good. I felt trapped. It felt like an abusive relationship, honestly. We'll dive into that in a different video. Let's talk about her increased bodily dryness. So this happens with Accutane because the drug reduces sebum production. So an excess of sebum is what dermatology recognizes as a root cause of acne. So that's why they prescribe this drug that makes you into a lizard. However, my personal belief, melded with what I've learned from holistic herbalism, is that it's not as simple as just sebum production. The question to ask here is, why is the skin overproducing sebum? And one of the possible root causes of this could be that there is an overproduction of a certain hormone, usually maybe an androgen like testosterone in women or estrogen. But do you guys see how just prescribing a drug that's going to halt all oil production, as opposed to digging deeper and saying, why is this happening? It's a very band-aid approach, and this is far from a band-aid. A band-aid you can just rip off and throw out in the garbage. This is serious. This is possible birth defects. This is your body reacting in ways that this is not normal. So the fact that a drug like this gets prescribed and has this many side effects is something that scares me for an issue that that mainstream dermatology and mainstream doctors could stand to ask, or further their education, or maybe just be open to what people like I have to say about. Maybe ask your client, your patient, about their diet. Maybe ask them about their stress load. Maybe ask them more. But I just don't see how this is a good idea of prescribing this drug when it has these types of side effects. Another thing I wanted to touch on is that your sebum production is directly linked to your endocrine system, to your pituitary gland, and to your thyroid. So doing this research and also watching this video, I started asking the question of, does Accutane have a negative effect on the thyroid or the pituitary gland? And lo and behold, it's seen that Accutane has had several cases of people having elevated suicidal tendencies, suicide attempts, and mood instability. Your mood and your general energy levels, all of your mental health, is tightly intertwined with your endocrinological system, meaning your thyroid as well as your pituitary gland. These two glands are responsible for your mood. They're responsible for your energy levels. They're also responsible for your skin, for your oil production, for your hair. So it also doesn't surprise me, and it wouldn't surprise me if the people who are also on Accutane were experiencing, before being on Accutane, were experiencing things like dry hair, low fatigue, general just down disposition to life. These are all organs that need to be addressed, or questions that need to be asked before you prescribe a drug like this. Let's get into it again.
I would groan getting up from a chair or a couch. I had constant lower back pain, and it was really hard for me to work out.
So the lower back pain makes me wonder if maybe she was having issues with her kidneys. Lower back pain is also something that happens around menses specifically. Like if there's going to be any type of back pain you have before your period or during your period, it's going to be the lower back. So it makes me think about her reproductive health as well. I wonder like how she's doing with her cycles, which is important too when it comes to your health. Your period is one of the markers of your vitality. That's what I've learned through herbalism and just through working with clients. So if somebody is not having a period on a consistent basis, that means that their vitality is usually low. Just a segue. But
the most terrible symptoms that I had never heard of before was sweating. I swear I have never sweat more than I did on Accutane in my entire life. My upper lip sweat, my eyebrows sweat. Even though I was having all of these symptoms,
this is the only symptom that I didn't know where to start even with hypothesizing why that was happening. So if you're somebody who thinks that you have, or that you're like, oh, this sweating happens because, or hyperhidrosis would happen because, let me know down below what your hypothesis is, what your theory is, because I saw this and I don't get why that would happen. I really don't.
Symptoms, I was seeing results, so that made it worth it for me. I actually haven't had a pimple in about 3 months. My skin is doing great. I was just so happy. Like, oh.
She giggled. I was like, my skin is doing great. Your skin is doing great, but at what cost? At what cost? I can fully say that I would rather get the occasional couple of pimples here and there, but have my skin at like a stable place, rather than never get a pimple again, but have gone through all of this, because that is a lot of stuff to go through. That's very uncomfortable. She said that it was affecting her day-to-day life, that she couldn't work out. She was in so much pain, which I guess it probably has subsided by now. I don't know if she's discontinued it or not. This video is from like Snapchat, but I don't know, guys. It's like I said, I empathize. I get it, because when you don't feel confident in yourself, it affects every single facet of your life. It affects the way that you show up at work. It affects the friends that you choose. It affects the partners that you choose. I wouldn't be surprised if people who struggle with acne are more predisposed to settling down with abusive partners because of a lack of self-esteem or self-worth. Just wouldn't be surprised. But I get why she says this. I'm happy that she's happy, that she feels a lot better. She seems a lot happier. But at what cost? So that was our video for today. Yeah, if you are on the verge of going on Accutane, I don't ask you to solely listen to me, but take what I say, or the accounts of people who have been on the drug, into consideration before you make the decision. Don't make the decision from a point of desperation, from a point of, this is my last resort, because there are ways to see progress after. I'll show you guys two photos of two of my clients and their progress. Both of them were on birth control for a while. One of them she was just prescribed doxycycline before working with me, and then we worked on her skin together. And then my other client was on birth control since she was like 14, and we worked together, and her skin is at a much more stable place. So I just say all this to say that make informed decisions. Don't feel pressured, please. If you get anything, I'm begging on my knees, please, if you get anything from this video, don't let your friends, family, I don't care who it is, coworkers, try to pressure you into a drug that you know nothing about. And number two, know that there's other options out there. It's hard work. I'm not going to lie to you. Approaching your skin from a holistic standpoint is something that can be frustrating sometimes. Luckily, there's people like me where I'm a coach, I'm an herbalist, so I can be there for you and be that support. But you can also make progress on your own. I started my journey by myself, and I've made wonderful strides. You can too. You do not have to resort to these drugs. As much as these dermatologists, your gynecologists, your primary care physician may want to throw it at you or say, this is your only choice, it's not. It is not your only choice. It is not. I don't care how many times I have to say it. You have a choice in the matter. You have a choice. And if what you do want, you do all your research, you watch this video, you read studies, you listen to accounts of people who've been on Accutane, and you get to the point where you're like, I still want to do it, then you know what? Kudos to you. At least you did it from a point where you feel informed and you feel that the risk outweighs the reward. Because that's all I want for anybody on here. I want you guys to realize that there is risk to this. It is not just it's not just any other decision, like, I'm going to get this milk today. Like, this has repercussions. Deciding to go on Accutane could have serious repercussions. Could have benefits, but there are long-term side effects that even today modern medicine is unsure of. So with that, I hope that you guys found this video helpful. I hope that if you are somebody who was on the verge of going on Accutane or was on Accutane, you feel a little bit more validated and heard. I completely understand of what it's like to be on that pharmaceutical side of healing your skin. It is not easy. It's not for the faint of heart. And if you guys want to see more reaction videos, please email me. I'll leave my email down below so you guys can email me like videos and stuff, or you can DM me on Instagram. I would be happy to react to more videos. Or if there's a specific question or topic that you have, whether it be parasites, about acne, about eczema, I would love to cover that as well. So shoot me a DM or shoot me an email so I can get to making a video for you. But that's all I have for today. If you forgot, please like, comment, and subscribe. And I hope you guys have an awesome day, and I can't wait to see you again.